Today we have Erica Carr from Peace Health, and she's going to talk to us about non-medical careers in hospitals. Welcome, Erica. So we can get
Well,
started?
thank you. Thanks for having me.
Yeah, thanks for
Yeah,
being
this is
here.
so different. Yeah, absolutely. This is just different. I love being going to the fairs directly at the school so I can meet you in person, but we'll make this work, okay? Um, so I'll give you a little bit of background about me. I've been with Peace Health. It's been 14 years, and I started in the human resources department in recruitment, and I've been there ever since, and I love it. When I visit with folks, whether it be in a high school setting or we do career fairs elsewhere, everyone always assumes that we're recruiting for nurses and doctors. It's like when you think of healthcare, that's what you think of. So people that aren't interested in those kind of career paths don't come visit us. But think of Peace Health here in the Eugene Springfield area. We have over 5,000 employees. So um, 5,000 people to make the hospital and the clinics run here. So you can imagine that not all of those folks are going to be nurses and doctors. It makes there's just a wide variety of folks that help us be successful. So I'm going to touch on those today. I specifically do recruit for nurses, and that's such a pain point, such a hard area for us to find folks for that I would be remiss not to talk about that. So I will bring that up and try and convince you to go into nursing. But one area that why we struggle to fill positions is there is such a shortage of healthcare workers, due in part to a large volume of people entering retirement. And so as we're losing just a lot of folks, they're going into the retirement, especially with COVID this past year. If they're at retirement age, they've opted to go in that direction. And so we have to backfill all of those people. And that's been a real struggle for us. And so that's why we're hoping that more people, young people, decide to pursue healthcare careers, whether they be non-medical or medical. There's just a huge growing demand for healthcare due to the average lifespan of people increasing. Obviously, people are living longer, requiring more healthcare. And so that's really driving the need as well. If you have any interest in improving the lives of others, healthcare is going to be a great career path for you. Not only that, but generally speaking, the pay as well is really good, and you can go anywhere. There's going to be healthcare needs um, all over the country, the world. So this is a career that you can take and use those skills anywhere. Particularly, I know we're going to focus on non-medical, but again, with nurses, there's travel nurses, and so those folks you imagine how exciting it would be to be a new nurse and to travel for work. They're providing you pay and places to live where you can work in the hospital setting anywhere in the country. So that's a great opportunity to both improve your skills, but also to travel. There's other positions that do travel as well, not only just nursing, but surge techs, physical therapy, pharmacy, kind of the list is growing. So if you've got a travel bug, that might be something to keep in mind as you're looking for career options. Um, so what do we look for when we're hiring a healthcare provider? So number one, Peace Health is mission driven. We're Catholic healthcare based faith-based organization. So we're looking for people that are really, like I said, mission driven. Bottom line is you have to care for people, and we really want people that are collaborative, excellent communicators, compassionate, and caring above all else. And you just want and have a difference in the lives of others. With Peace Health in general, we have not only the hospitals here in town, which you're probably familiar with, which is Riverbend and Springfield and University District downtown Eugene, but we also have hospitals in Cottage Grove and out in Florence. And then up in Washington, we have we have hospitals in Bellingham, which is near Seattle, Cedar Woolley. We even have this darling little hospital in the San Juan Islands. And then last but not least, we have a hospital up in Ketchikan, Alaska. So again, kind of harkening back to if you like to travel or explore new places, we have hospitals in some really beautiful settings. So that's can be pretty exciting. So there are so many healthcare options. Like I mentioned, we have 5,000 employees, so it runs the gamut from anywhere entry level, like food service or environmental services, all the way up to physicians. I'm not going to talk a lot about physicians. We have a whole team that recruits just for MDs, so I'm not familiar with that, so I'm not going to go there. But starting with food service, if that's something that you'd be interested in, we start hiring folks. Our only rule is you have to be 18 years of age or older. But for folks like in food service right now, our starting wage is $14.17 and it goes up. One really nice thing about Peace Health, and I think a lot of healthcare organizations are kind of going in this direction, is they do offer benefits even for part-time employees, which is really nice. So it's a good opportunity if, let's say, you do want to kind of maintain a work schedule and go to school part-time. That's definitely doable. And we have a lot of employees that are doing that currently. Additionally, we also offer tuition reimbursement, so that helps as well. But back to kind of more of our entry level, like we have the food service, the environmental services, and then it progresses up from there depending on your level of interest working with patients. So if you don't want to be hands-on, but you do want to interact with patients, we have patient access reps. And essentially that is the individual that you'd be encountering if you were to check in at a hospital or in a clinic. It's kind of the frontline person. And so those are really important roles for us. And what's nice in a hospital setting, it's a 24/7 operation. So we do have night shifts available, mid shifts, and day shifts, depending on kind of what works for your lifestyle. Something that you probably haven't thought about as a high school student, but you will as an adult, is when you do these kind of off shifts, we also offer, we call them differentials. And so when you're working kind of these off shifts, like the night shift isn't everybody's cup of tea, but we do offer additional money per hour kind of as an incentive to do that. So if, as you're looking into careers, after school, after high school, that's something to keep in mind. And then like weekend shifts also have a differential as well. If you're really kind of more dead set on like a Monday through Friday, 8 to 5 scenario, then you're going to want to you're going to want to look for positions in a clinic setting. So you're probably familiar with like the Peace Health medical groups that are around town. And those are typically going to be a Monday through Friday kind of schedule for folks. So that's nice as well, if that's important. Um, but again, so okay, we touched on some of the more entry level. As you kind of progress up, think about there's the frontline workers that are dealing with patients, but all the behind the scenes that's happening, all the business office that is working that is doing the billing, that is doing the scheduling. Gosh, we have a we call it the service center, and it's up in Vancouver, and it's comprised of all of the like executives or the accounting and financials, the human resources, the real behind the scenes folks that you never see, but are really kind of making or doing the operational parts of the hospital. So if that's more kind of your interest level and not the hands-on patient care, that's something to definitely keep an eye on. A lot of those do take at least an associate's degree. A lot of folks that we see have that healthcare administration degree, or if you're going into an accounting, kind of that line of training. Even something along like a human resources, that's a really valuable part of any organization, but especially at Peace Health. And so I feel like I make a difference in a patient's lives by the people that I hire. And so that can be really a fun part of my job. Let's see. I want to touch on some other areas.
Erica,
Again, oh yeah, sorry.
I was just gonna ask, we did have a question about whether or not people move around
Yeah.
very much within the organization. Like, is it common for
Oh,
people to take a position, a non-medical position, and either move into a medical position or move around among, you know what I mean?
yes. Oh, that's an excellent question. And I like that question a lot because the one thing, working with Peace Health all the time, the 14 years I've had, I've seen people start, for example, I'll use an example of a guy that I started with. So I started with him in 2007, and he was a recruiter like me. And then he progressively just worked his way up, and now he's a system director up in Vancouver. Um, so he's just a small example of the growth that I've seen here at Peace Health. We really, I mean, more than anything, we like promoting from within, and so definitely I've seen folks really move up the ranks here at Peace Health. Another example is our current CNO, which is our chief nursing operator. I remember when I started in '07, she was a nurse herself, a new grad, and now she's the CNO. So, after a few years, she worked her way up to charge nurse, then assistant nurse manager, then nurse manager, then director. And so it's really fulfilling to see people that you like. For me, I'll hire someone and I'll see them year after year just getting progressively higher in leadership roles and really making a difference. So, yeah, there's a lot of opportunity here. I think that's one of the really beautiful things about working for Peace Health and a big organization in general. We also strive again to offer tuition reimbursement. So if you're, for example, I'll see a lot of folks who want to become CNA or who are CNAs with us and working part-time, and then they go on to LCC to do the nursing program. And then we'll end up hiring them in that as a new grad nurse. And so that's really exciting, I think, and it's great for our community. But yeah, that was a really good question. um, Kind of touching on again, this is nurse focused, but I'm right now in the midst of posting and hiring for 55 new graduate nurses. And the majority of those nurses, or a big chunk of them, are probably going to come from LCC. The nursing program. And so we've really committed to hiring our new grads here at Riverbend. And we also have the same program at our hospitals in Washington. And that's exciting because as a new grad, whether you are in nursing or pharmacy or whatever the case may be, it's hard to get your foot in the door because so many times you'll see the job profile will say, 2 years of experience or whatnot. Well, how the heck do you get that experience? And so we had encountered that for many years. Um, that that need combined with the fact that we have so many nurses retiring, it's like, well, why not hire new grads and train them and provide them that additional training? They've got the great, they've got the schooling under their belt. Now they just need that additional training and that support. So gosh, it's been about the last 4 years, we have a really robust residency program. And again, I'm just in the process now. We're going to hire 55 folks for this next cohort, we call it. So if any of you have any inclination about going into nursing, I think rest assured that there's going to be opportunities when you get out of school. So that's one of the nice things about pursuing something like that. Any other questions? I don't want
One question, it goes back to the travel nurse position that you mentioned. And I would imagine there's
Yeah.
a wide variety of places that nurses can travel to. But what is like the average length of time that a travel nurse would stay in a single place? In other words, you know what I mean? How many times a year would they move around?
Yeah.
And is it statewide or is it really across the country?
Oh my gosh, it's across the country. So I'll I don't want to bore you too bad, but so with especially with COVID, the with the pandemic, travel nursing has always been a big thing, but especially with the pandemic, you'll know certain, I mean, we all watch the news and we'll know that certain areas of the country have been hit harder. For New York State, for example, well, how are they will hire travel nurses to help them with their patient load. So we've seen a lot of nurses take travel assignments out there to help, that's just an example. But even pre-pandemic, travel nursing's been very popular. That's how let's say we have an opening, which we always have openings, but the patient load hasn't gone away, but we just still need the nurse. So we'll hire, we call them travel nurses. So it's somebody that would come in and fill that spot. Usually their assignment is for 13 weeks, but they can get extended. So a lot of the time, especially in this area, this time of the year, we'll get travel nurses who do 13 weeks. They love it so much, and we still need their help that we can extend them. But then there'll be nurses who say, nope, I want to just stick my 13 weeks and then travel somewhere else. So the company that they're working for will assign them to a different location. So if you were so inclined, you could go to a different hospital every 13 weeks. Um, so anyway, I don't like, for us travel nurses, we don't hire, we don't, we would prefer to have someone come and stay. but I always encourage, especially young people, I mean, when you're right out of school and you don't have any, family ties, and it's your time to kind of explore, um, that's a great time to experience travel nursing. It's also cool because we get travel nurses at Riverbend who come for their assignment, and they like it so much that they say, heck, I want to stay here. And then I get to hire them full time to a position. So it gives you kind of a cool perspective on how different hospitals are organized. How leadership is. I mean, we'll have nurses come to Riverbend and say, gosh, this is the best assignment I've ever had. I think I want to settle down here. So that's a win-win for us. But yeah, I just always like telling young people about the travel nursing, because I know how appealing that would be to me. So if it kind of motivates people to consider nursing, then by all means.
Right.
um, but again, physical therapists do that as well, pharmacists, surge techs. That's a big area that we are kind of struggling to fill now, are our surge techs, which is essentially the person who's in the OR assisting the surgeon. So when the surgeon needs a certain tool, you're providing that. And so they have traveling surge techs, but we are always needing to fill those positions as well. But again, if you're thinking, I don't like blood, I don't want to deal directly with patients, some other areas that maybe you haven't thought about are pharmacy techs. We have a real need for that. And it doesn't require a lot of schooling. And maybe it's something that you could do, and then you decide maybe you like it so much you want to pursue like pharmacy, which is another great area to go into. Sterile processing techs, I hire those people quite a bit, and they're the people behind the scenes that are cleaning, that are using the equipment to clean all of the tools. So you're involved in healthcare, but you're not, again, hands-on with a patient, which I like being a nurse recruiter, but I could never be a nurse. It's like, ah! But so I totally get it if that's not something, if you don't want to be necessarily hands-on. Some other areas, let me see, I'm going to scroll. We have so many areas that I always have to kind of refer to some cheat sheets here. Gosh, physical therapy assistants. Not only do we need physical therapists, but assistants, respiratory therapists, especially now with the pandemic, it affects lungs. That's been a big area. Again, it's going to be hands-on, but it's something that is vitally important, and it's really going to be hard to find. So I don't know where you are in your in school, and if you're going to be graduating soon. I mean, it'll still take you probably a couple years to get your degree, but I would almost guarantee that even in a few years, the needs there are going to be so strong that they'll be offering sign-on bonuses, relocation assistance, very competitive wage. I try and stay up to date on all of our kind of where we are as a state as far as how competitive we are. And Oregon is always top for how competitive we are for wages when it comes to healthcare. So if Oregon is kind of an area you want to stay long term, this is going to be a great area as far as wages are concerned. Let me see, even things like, well, let's see, med techs. We have a whole lab. So if you're interested in more of the lab aspect, that's not necessarily patient hands-on patient, there's going to be like med techs that are needed. Phlebotomists, of course, that's going to be hands-on, but it's a big need for us. Dietitians. Let's see, what else? Oh, this I'd be remiss not to mention the whole behavioral health aspect. Not only like psych nurses are a big need because a lot of those people are entering retirement age, but medical social workers, that's going to be continue to be kind of a big area that we'll need to fill. Um, Therapists, speech language pathologists. So again, that's and actually U of O offers a really good program in speech pathology, and that's always kind of been a tricky area for us to fill. Um, I talked about again, those are patient driven, but the more behind the scenes. Again, human resources. I mentioned the guy that I worked with who became the director. That's kind of his pathway. He's going to be dealing with the employee relations issues, hiring, terminating, doing oh, performance reviews, that sort of thing. There's going to be a whole segment of healthcare that's dedicated to the marketing and the public relations, so and social media. So I think people sometimes forget about that, especially if that's an area that really interests you. You can tie that together with healthcare. Again, I mentioned financial analysts. There's a huge segment of our team that's dedicated to IT. So doing assessing our computer needs and being kind of our help desk. And then maintenance technicians. We employ electricians, biomedical techs who work on the equipment. So yeah, if you can imagine that, if you've seen Riverbend, the hospital, it takes a lot of people to make that place tick, and that includes the electricians and those folks. So, gosh, I think I kind of went all over. Oh, another area that we recently, I keep thinking of things that we have a big need for security. And so, if that's something that you'd be interested in, is in the security aspect, then we have that as well. So, does that help? Any other questions?
Yes, we do have a question. One student asked, as someone who is considering nursing and wants to get a jump start on hospital experience, what jobs could I apply to for the summer with only a high school diploma? Excellent question.
Yeah, these questions are awesome. I'm impressed. Okay, so I would, with um, honestly, I would probably look for our food service or environmental services, and environmental services. Honestly, that would give you such a unique and appreciative perspective of the hospital that I think would be really valuable. So those would be kind of two areas that I would look for. Again, they're entry level, so just a high school degree is going to be sufficient. And the other thing is we do hire when you're looking on our website and you see, we'll be really clear if it's going to be full-time, part-time, or we could have a lot of positions that are called per diem. So that might be something to think about when you're trying to balance school, and per diem means as needed. So typically what will happen is in a given time schedule, the manager would say, okay, what would be your availability this next 2 weeks? And you'd be say, well, gosh, my classes are from 8 to 4. I can be available in the evening, or whatever the situation is. And then should the need arise and they need to fill that spot, they know, oh, you said you could work, this evening. Are you available? So it's kind of picking up as needed shifts. Um, there's no benefits with those, but on the flip side, you do get a differential. Means that it's a kind of an additional pay on top of your base rate. It's the incentive to be per diem since it's not ideal for a lot of people. It might be ideal for a student though, so that might be something to think about. But yeah, I would maybe focus on those two areas.
Yeah, great question. Any other
Yeah.
questions to be dropped into the chat while we're still recording? Okay, Erica, I'm going to go ahead and stop recording. Thank you. That was good
Okay. Yeah,
information.
I didn't.
And we'll do
Okay.
some Q&A after.
Sorry. Whoa.